Is there a conflict brewing at the heart of American healthcare? Are we witnessing a tug-of-war between the physicians for a national health program state-by-state approach and the pressing need for federal healthcare reforms? This is the provocative question we delve into today. On one side of the ring, we have the Physicians for a National Health Program, or PNHP. Their strategy? A state-by-state approach to implementing single-payer healthcare systems. They argue that such an approach allows for more tailored solutions, understanding that each state has unique healthcare challenges and demographics. They believe that by addressing these individualized needs, the overall health of the nation can improve gradually and more effectively. But on the other side of the debate, we find advocates for federal healthcare reform, among them injured workers and doctors. They argue that the state-by-state approach is a piecemeal solution to a national issue. These advocates insist that comprehensive federal reforms such as Medicare for all and workers' compensation reform are the logical and necessary steps to truly address the healthcare crisis. They argue that these federal reforms would ensure equal access to quality healthcare for all Americans, regardless of where they live. Interestingly, Democratic lawmakers seem to be backing the PNHP's state-by-state approach. But why? Is it because they see the state-by-state approach as a more feasible solution, or is it a political strategy to avoid taking on the behemoth that is Medicare for all and comprehensive workers' compensation reform? This lack of action on workers' compensation reform certainly raises eyebrows. Injured workers are left in the lurch, waiting for changes that never seem to come. Is the focus on state single-payer systems drawing attention away from the need for broader federal reforms? So we are left with a conflict between a gradual state-by-state approach to healthcare reform and the urgent call for comprehensive federal changes. A conflict between those who believe in tailoring solutions to each state and those who believe in equal access to quality healthcare for all Americans. This conflict has implications that reach far beyond the healthcare industry. It touches on questions of federal versus state power, the role of political strategy and policy decisions, and the fundamental human right to health. So, where do we go from here? How do we reconcile these two sides of the debate? The answer is unclear. What is clear, however, is that this conflict will continue to shape the future of American healthcare. As the debate rages on, one thing is certain: the health and well-being of millions of Americans hang in the balance. A voiceover. We're left pondering, why are Democrats selling us Republican incrementalism? Is it a strategic move or a compromise on their part? Some argue that Democrats are adopting this approach as a strategy to gradually introduce reforms without alarming those resistant to change. Others suggest it could be a compromise, an attempt to find common ground with Republicans on an issue that has long divided the nation. This approach, whether strategic or compromised, undoubtedly shapes the healthcare reform debate. It influences the pace at which changes are implemented, the scope of those changes, and the public perception of healthcare reform. So, we're left asking ourselves, is this a case of political maneuvering or a genuine belief in the effectiveness of incremental change? Voiceover. Meanwhile, the American Public Health Association, APHA, and a chorus of medical professionals are championing a different approach. They're advocating for basic federal human rights that our workers have needed since 1972. They're calling for a National Workers' Compensation Commission to address the disparities and inadequacies in our current system. This call is an important part of the broader healthcare reform discussion, but it's often overshadowed by the more contentious debates. The focus on state single-payer systems, while important, is drawing attention away from these pressing federal needs. It's a reminder that the healthcare reform debate is multifaceted, with multiple stakeholders and a range of solutions on the table.